When COVID-19 hit, most people had no idea what a respiratory therapist really does, nor did they understand the life-saving role these therapists play. Latrice Curry explains the very important job of a respiratory therapist at Ion Health.
It's a scary situation, but like I said, we do it as quickly as we can and ensure that they're safe.
The entire world saw just how scary this pandemic is when even the President of the United States tested positive and was admitted to Walter Reed Medical Center. Shelby Hansen and Rebecca Varnell are respiratory therapists at Erlanger. And up until recent months, when the pandemic hit, a lot of people had no idea what they did. They have not only been on the front line of the battle against the coronavirus, but they play a crucial role in saving the lives of COVID-19 patients who end up in the hospital fighting for their lives.
We're really seeing people through the progression of this virus. So we'll see them come in just kind of short of breath, can't catch their breath. Their oxygen goes down, and slowly it's just like a cascade effect where then we have to put them on a BiPAP, and unfortunately they'll get intubated.
I spoke to one of those patients earlier this year. He was the first recovered COVID-19 patient at Erlanger.
I was intubated for 16 days, and I was their first COVID patient in critical care. So a lot of the things, the treatments that they did on me, they didn't even know if they were going to work because there wasn't enough information out about it.
Giersdorf said he still has lingering side effects from the virus. COVID-19 often attacks a patient's lungs, making it difficult, if not impossible, to breathe on their own. Without the careful and skilled monitoring of the conditions by respiratory therapists, many patients would not survive.
They're very hard to ventilate. They're extremely hard to oxygenate. You have to find that middle ground that is able to ventilate the patient and keep the settings at a reasonable level.
I mean, these people have no reserves. You can literally take them off their oxygen for a second and they'll desat down into the 70s and they'll turn blue.
They say changing out a piece of equipment or filters takes precision. It has to be done quickly and safely. There are currently more than 7.6 million COVID-19 cases in the United States, and more than 212,000 people have died from the virus.
We were having to rent ventilators at one point, but we're in a good position right now.
And now that we're in it months and months in, we kind of have a routine and we know what to kind of expect.
While the curve is flattening and we are seeing some improvement thanks to guidelines like the mask mandate and more people following CDC guidelines, we are certainly not out of the woods just yet.
We really want to ask everybody to continue to wear a mask and to, participate in helping us keep everyone else safe.